This is in addition to the usual traffic checks around this time of the year, but COVID-19 compliance will be monitored on major routes throughout the Eastern Cape. Large volumes of people are expected to arrive in the province. Officials are out in numbers to enforce COVID-19 compliance and road safety. For more on this, let's cross to our colleague Abongile Jantjies. He's on the N2 in on the Kai Bridge near Butterworth. A very good morning to you, Abongile. What can you tell us about where you are?
Yes, indeed, Desiree, you are at the N2 in Kai Bridge here in the Eastern Cape, where a number of vehicles are making their way here. There's a stop and search that's happening here, made up from the Department of Transport, including the health department here in the Eastern Cape. Well, the numbers for COVID-19 in the province remain low, as there are just 187 active cases. With me, I have the MEC for Health, Nomakhosazana Meth. A very good day to you, MEC. Kindly take us through this program today.
Good day to you and the viewers at home. We are here with the Emergency Medical Services team. As we all know that it is Easter time. We are here because we are ready to serve our people. We want to be ready when we are called in case there is any accident that has happened. But we want to wish our people a very happy Easter within the COVID-19 environment. We appeal to our people to remain to be vigilant. We are facing a time when there's the Easter after the COVID-19 since 2020, when we, during Easter, were able to say people must stay at home because it was at lockdown level 5. Because now we are at level 1, there is a lot of movement, and we can't say people must not go to churches, we can't say people mustn't go to their homes, but we want our people to be vigilant, to be careful, to drive very safely. But we, as the Department of Health, we are here when we are needed to be able to provide the much needed services in the roads that our people are traveling on.
Are there any major incidences that have occurred since today?
Yes, already now we're supposed to be here with our helicopter, but it had to attend to another accident, and there's another one that happened just here earlier on today. So we are already attending to that, and we can see our people are ready, the technicians to attend to emergencies, our vehicles, emergency vehicles, and everything else. We are just ready to help our people.
I know you've answered this question before, but should the numbers of COVID-19 rise in the Eastern Cape, take us into your confidence on the preparedness of the hospitals here in the Eastern Cape to cater for that?
Almost more than 94% of our hospitals have vaccinators that are trained, so that if then the third wave comes, we are able to also be doing the work of vaccinations. Because remember, we've been complaining about the availability of the doses because with the J&J research project, there are only a few available doses. But now we are happy the number is increasing. So we want to move with speed to vaccinate our health workers in particular. But if then the wave can hit us, we are ready with our facilities. As you know, again, that during phase 1 and phase 2, we did make our facilities ready. We've got enough beds, we've got enough ICU beds, we've got enough people to attend to our patients, as even the contract workers whose contract was ending at the end of the 31st of March, we have managed to extend those for a year and 3 months. So we are, in terms of human resource, in terms of our facilities at the hospitals and all the other facilities like your clinics and community health centers, we are ready to attend to our people.
MEC, the Deputy Public Protector yesterday released a damning report of the controversial EMS scooters here in the Eastern Cape, saying that the procedures were not followed properly, and she has ordered you and the acting SG to make the people who are involved to account. What can you say on that?
We welcome the report of the Public Protector, and we heard the Public Protector when she was presenting her findings. We are prepared to cooperate, to do what we are told to do within the time that has been put. I'll be working with the SG of the department to implement what is the resolution or is the decision that was taken as an action that we must take against all those who are affected. So we shall follow suit and comply with the time frame that are put by the with the public protector.
How will you ensure during your term in office that incidents like that don't occur? MEC, what are your monitoring strategies within the health department, which is a crucial department compared to others?
In fact, it is important that when we work as all the public servants and public representatives, that we do what we do according to law. South Africa is a government that is well regulated in terms of law. So we must at all times strive to do what we are doing within what the law requires. So I'll make sure that we don't repeat the same mistakes, because we must learn from the mistakes sometimes that we are committing in the process of us trying to provide services to our people. So we are committed to clean governance and good administration when we shall do that as we continue to do our work in the province and in the department.
I thank you so much for your time, MEC, and all the best for this weekend.
Thank you so much, and happy Easter to you.
Thank you.
Be safe. Thank you so much.
Well, Desiree, that was the health MEC here in the Eastern Cape, Nomakhosazana Meth, telling us about why we're here today, and that controversial EMS scooters that were highly talked about last year. That the Deputy Public Protector released a report on it, and that she must act on the individuals implicated on it. From us here, it's back to you in studio.
Abongile, thank you so much for bringing in that current aspect of the Public Protector report that came out yesterday, of course, given